It's okay, Jade. Are you okay with, oh, you just hit the recording button. So I want to say welcome to everyone for this kind of end of year Advancing Cancer Research Council um, conversation and get together. I'm excited for today's presentation because not only do we have Dr. Steineck with us, but members of the team that she works with. So there's some probably unfamiliar faces on this call, but I think by the end of the call, we'll be able to know a little bit more about how they fit into the work that we are supporting with Dr. Steineck and her research. So I'm excited everyone's here today. My colleague Kimberly mentioned that Dave Benson may join us, and if that's the case, he may have a word or two, but since he's not quite here yet, Kimberly, are you okay if we just get things started? And if he comes on, if we need to kind of at a halt for a minute, we might be able to do that. So Dr. Steineck, I'll let you know if that's the case. But if he's not here, I think we should just get started and say, first of all, thank you for everything you do in support of the Advancing Cancer Research Council. We're coming to the end of the year, but we are excited by what we've seen and heard from this year and excited for this afternoon's presentation. And wanted to give a little extra kind of note about things that have happened from the past for some of you that have been a part of the ACRC for a couple of years. Jade, if you can, go to that second slide. One of the researchers that we followed in the past is from last year, Dr. Reese Punya, and I just wanted to give a really short kind of follow up on that because I think it's always fun to know what's happened since we have connected with that part of our work at the American Cancer Society. And this was a part of our team who's in population science. And I know we met, I think Madison Hall from her team last year. But we wanted to at least let you know that from that work from 2023, Dr. Reese Punya did submit a paper to a journal in June and is still waiting to hear if it's been accepted. And I think the piece that she mentioned to me was, it takes longer than you think. So because of that, that is certainly something we'll keep in touch with everyone about, because if that does get published, we certainly want to share it with this group in terms of outcomes. But we also, when we send out this call, wanted to at least relate to some of the work that has been published that she's doing that is still in this space of cancer history and older adults and physical activity or inactivity. So because there's not a full answer right now on what's happening, I thought it would be great for you to see some of the published works from this individual that we helped support last year. So that's a short update, but hopefully when we know more about the that paper, we'll be able to share it with this group, because it's always good to know where things are going overall. So thanks, Jade, for that. Just a couple things just to mention for this call. It looks like I think most folks are muted, but we ask for folks to remain muted during the call until we get to the portion where you're welcome to ask questions. As I said at the beginning, we're excited that Dr. Steineck is here and has brought a good number of folks from her team to help us understand a little more about how the work happens for her and, kind of hear the update since we saw her last in September. So we're excited to have her here. I think that covers just the introductions, and I just want to kind of give it over to Dr. Steineck. I think we have everything set up for you to share your screen, Dr. Steineck. But we're excited to have you and members of your team with us today. So thank you.
Well, thank you, Kathleen. I'm going to try to share. Let's see.
And we can help too, because Jade and I both have it queued up if you need that.
Is it sharing my? No, it's not.
Do you want to have Jade just share it? We've tested it.
Sure. Why don't we do that so that I don't waste your time?
Okay. Jade, are you able to get those slides? Great. Perfect. Thank you.
Oh, perfect. There we go. So again, I am Angie Steineck. I am an assistant professor at the Medical College of Wisconsin. And I'm so happy to be here again with you guys. I can't believe it's already been 3 months to the day since we last saw each other. And again, my area of interest is really amplifying the patient voice, particularly in pediatric oncology and novel treatments that we use in that capacity. So I'm going to ask for us to move to the next slide. And again, just a warm thank you for letting me come back and share with you some updates and introduce you to my research team. I'm realizing right now that before this, I was so excited to invite them that I forgot to tell them that if they want to speak up and introduce themselves in a little bit when I ask them to, that they are welcome to do that. So this is my reminder for that. All right, next slide, please. So Kathleen and I have been talking about how really this work in particular is truly the labor of teamwork and collaboration. And so I've been very, very fortunate to work with a number of different people, but I threw together this little schematic to really show how much involvement there is from a team. So this project in particular is going to take place at 3 different sites. I have a couple of pictures up here. Molly Taylor from Seattle Children's Hospital and the University of Washington is a dear friend and longtime collaborator. We trained together out at the University of Washington, and she is my partner in crime out there. And then Dina Levine, who is a friend and mentor at St. Jude, who has worked with me on my prior research studies as well, is leading the group down at St. Jude. And each of their respective teams is broken down into other members as well. So they have research coordinators, research assistants, nurse coordinators, things like that, all to make the process really seamless. And not listed here, I should say, also are the people in our institutional review boards who are making sure that we're following all of the regulatory rules. And then we also work really closely with people in the business office, and there are other people on this page that I have not called out, but these are the key people involved in moving this forward. As far as our team at the Medical College of Wisconsin, we have awesome representation here today. Peyton, Kira, Jesse, and Meredith are all here, so thank you so, so much. And with that, if any of you four would like to introduce yourselves or your role on the team and a little bit about how you've contributed to this, I welcome you to do that right now.
I can start. I'm Peyton. I'm one of the clinical research coordinators in our clinical trials office. And I help with recruitment, consenting, and carrying out of a lot of the study activities.
Hi, I'm Kira. I am the exact same thing as Peyton, also a clinical research coordinator. And then also Meredith would like me to note that she's our clinical research nurse. So she's the person that kind of ties the research side and clinical side together for us. She has a lot of background noise in the office right now and doesn't want to disturb anybody. So.
And I'm Jessie. I'm the regulatory supervisor in the pediatric CTO. I'm handling the regulatory side of the study and coordinating things on our end as the IRB of record for the multi-site study.
She's also our multi-site guru, so has been helping us navigate that and coordinating communication with the different teams at the other centers. All right, thank you guys. We'll move to the next slide. Oh, okay. We'll move again. All right. Some other people who've been really instrumental to this work as well. I work at a teaching hospital at a medical school, and so I have the privilege of working with medical students as they learn how to do research, and so that's been a lot of fun. Jordan and Emma I work with really closely in their research training. They both kind of like minor, if you want to think about it that way. So they major in their medicine, but they minor in clinical research. And so they both have worked with me on different clinical research projects. And Patrick McSweeney is a colleague at Cincinnati Children's who is also a patient advocate and is kind of my sounding board that I routinely go back to and make sure that my science is really following and true to what is most important to the patient experience. And so he's kind of serves as my North Star. All right, we'll move to the next slide. And then, of course, this is a Mentored Scholar Award. And so these are my mentors. Each of them are fabulous and fierce women in medicine and research. Jennifer Knight is my primary research mentor here at the Medical College of Wisconsin. She is a psychiatrist and internist and has a research focus in behavioral interventions in oncology patients. Catherine Flynn is my scientific methods advisor in patient-reported outcomes. And then as Abby Rosenberg is my mentor from Seattle, who has now moved out to Boston to greater pastures and continues to advise me on a lot of the work that I'm doing with this project because I'm really following in her footsteps. So again, multiple levels of advising and teamwork. We'll move to the next slide. So just as a reminder for this particular goal project, we have two goals. One is to interview patients, caregivers, and clinicians about their priorities for an uncertainty management intervention, and to test this intervention to see if it's feasible, acceptable, and meaningful. We talked a lot about that last time, so I'm not going to spend a whole lot of time talking about that this time, but we can talk about some status updates in the next slide. So we're now not quite 6 months into this award, and the overarching award for this is 5 years. And so to date, a lot of the work that we've done has been dedicated to the very exciting regulatory and paperwork side of things, but we have done a little bit of research work, which is also very exciting. So at the Medical College here, we have completed 5 provider interviews and 1 patient interview. We have managed to get full regulatory approval and completed our launching at Seattle Children's Hospital. So we completed our site initiation or orientation visit there, and we are working on getting that same thing done at St. Jude. Next slide, please. So a little bit about the outlook for this project. In the next 6 months, I'm really hoping to hit the ground running and get really close to finishing up our interviews at the 3 different sites. So trying to make really good progress in those clinician, patient, and parent interviews. And then looking at the next 12 months, looking to complete all of the interviews and then start pivoting to that actual clinical trial intervention piece. And so first steps first, I have to finalize the intervention program depending on what we hear on our interviews, and then at the same time also work to getting the regulatory approval to move on to the clinical trial phase. All right, I'll have you move to the next slide. Some other updates of things that I've been working on in the meantime while we're waiting on making progress from a paperwork and red tape standpoint. I have been working on sharing the results from the study that kind of formed the foundation for this work. And so I've been able to present that at a couple of different places, and I'm working on a paper to submit early next year. And so what this all shows is that as part of the prior study, I collected surveys or patient-reported outcomes in children and parents after CAR T-cell therapy. And here I am showing that we were actually able to follow a good number of these patients over time. So we had almost 60 children and almost 70 parents complete surveys at baseline, which was before they got their treatment. And then we were able to follow 46 and 60 parents out to 3 months, and 14 children and 19 parents out to 12 months. And a lot of the drop in these numbers was because kids got sick, or unfortunately some passed away and weren't able to complete surveys. But as a survey scientist, I'm really happy with these numbers, and it shows that really the efforts of my research team have been really successful in this work. But what we learned was that we could identify some of the symptoms that were most bothersome to families, children in particular. So things that you would probably expect to see: fatigue, pain, loss of appetite, worry, nausea, vomiting. Those were the things that we were tending to see. But this helps highlight some of the areas of opportunity for things that I can do as a clinician and as an investigator to try to fix, to make CAR T-cell therapy more bearable to families. What I also learned is that the burden that patients experienced from their symptoms really mirrored how they rated their quality of life over time. And so on the top graph, you can see I have graphed out their quality of life over time. And you can see that their lowest measure was before they even received treatment. And this was probably because they have active cancer and they feel like garbage. And after the treatment, you can see that number go up, which is what we want to see. Their quality of life improved. And then over time, it kind of stabled out, or maybe declined a little bit as they got further out from their treatment. And I think a lot of this is quite variable and probably dependent on, I have a lot fewer patients who completed surveys at the later time points than at the earlier time points. On the bottom graph, you can see that there's almost like a mirror on the other line, where this one is graphing out symptom burden. And so at baseline, their burden from symptoms was the highest. And when quality of life peaked, we see the lowest point for symptoms, and then again, it kind of tapers off over time. So this tells me that somebody who's trying to develop an intervention for CAR T-cell therapy, this tells me what time points patients and parents might need or most benefit from certain types of interventions that are focused on looking at symptoms. All right, I'll have you move to the next slide. And then there are some other things that I've been working on. I've been privileged to work with a group nationally called the Pediatric Real World CAR Consortium. And as part of that, we have launched a survey-based study that is collecting similar data from what I just shared, but not just at 3 sites, at 20 sites nationally. And so this is really a database of unprecedented scale. And so I have been able to work on this project also because of the support from all of you guys. So I'm trying to work on multiple things and give you guys the best return on investment in multiple different avenues. Also related to this, I've worked on publishing a paper that really looks at access to care in pediatric oncology patients with a specific focus on CAR T-cell therapy. So the punchline here is that it's really hard. Children are not little adults, and there are a lot fewer pediatric cancer centers in the country than there are adult cancer centers. And what that means is that sometimes for very specialized care or for clinical trials, children have to travel to different hospitals, sometimes out of the state, sometimes across the country, to receive this care. And there are a lot of barriers from insurance companies financial reasons, other social reasons from families that prevent accessing this care. And so I worked with some leaders in the country, well, nationally, internationally, actually, to write a paper about how we can maybe work to overcome some of these barriers so that kids with cancer can get the care that they need. And then a couple of other things that I have been working on. The Children's Oncology Group is a national group that really defines our science and is the basis for which we all practice our standard of care in pediatric oncology. And then the American Society of Transplant and Cellular Therapies is a similar professional society, but focused on any patient with transplant or cellular therapy, so not necessarily pediatric oncology. And I've been working with both of these groups to really standardize the research methods that we are using to collect data. And then finally, I've been working on a fun side project to look at the effects of CAR T-cell therapy on our DNA, and in particular, how we age after we get CAR T-cell therapy. And this is very, very preliminary, but working with my good friend Molly Taylor from Seattle Children's, we've been able to kind of use some of the data that we've both collected to try to learn something new from the data that we already have laying around. All right, and I'll have you move on to the next slide. And then just again, to recenter on the 10-year plan for me. We talked about this last time, but really I'd ultimately like to be able to apply this work to larger scale efforts. Can I really make a difference with the interventions that I'm planning? Does it help families? Is this something that I can apply to different pediatric oncology populations, or even patients who don't have cancer, but maybe are going through cell therapy or gene therapy for thalassemia or sickle cell disease or things like that? So really hopeful to not just widen my scope in the future. All right, and then I'll move to the last slide. So again, thank you. And again, a list of all of the people who've been really instrumental to this work, including this group here. So thank you very much. And with that, I'll have you stop sharing so that we can chat a little bit more.
And I'll just thank you, Dr. Steineck, for giving us that perspective. And I think we can go even farther in some of these spaces. You know, that first slide that you showed us that kind of represented the 3 teams. And since you have your entire team here from the Medical College of Wisconsin that are working with you, and they gave us a little bit of a kind of a idea of how that works. I think it'd be great to hear sort of on a daily basis, or how you all connect and work together. And, you know, when you said there's a few interviews or, you know, conversations that have happened, how you all work through. And then just because I think it'll be fun to talk about regulatory stuff, we'll get to that side of things. I think that's Jesse. So I'm sort of start maybe with Peyton and Kira, and I think Meredith is the one that's off, not able to talk, but perhaps talk about the daily, and then like to Jesse to talk a little bit more about the regulatory side of things.
I can start with a little, and then Kira, Meredith, feel free to jump in or if I miss anything. So we meet regularly. We are all on the same team, so we're regularly meeting like throughout the week, at least 2 or 3 times. And then we specifically dedicate time every week to the study, to just go review patients, see if there's any new patients. We always have, you know, people on our radar. But a lot of our coordinating right now has been with opening the multi-site and getting our manual procedures together for sites so that they know what they need to do once they're open, as well as assisting with regulatory stuff. So
Yeah, I would say one of our biggest things that we're doing right now is making sure that we can be the best coordinating site for the other sites as well. So not only having our own ducks in a line, but making sure everybody else will have the proper tools and assistance to have their ducks in a line for when the studies are officially open and enrolling for multi-site. So
So they're being too modest. They're they do a lot of work, including babysitting me and making sure that we are all accountable to each other and moving the work forward. So they spend hours each week dedicated to looking at the patient charts and making sure that we're capturing every patient who's walked through the door with CAR T-cell therapy. They are sending lots and lots of coordinating emails to the different sites and writing tirelessly multi-page documents to really make sure that we are all doing the same work rigorously. So they're amazing.
Joyce and Mike, it looks like you have a question.
Yeah, real quick, what percentage of the patients and the patients' families actually enroll in the study during your recruitment process?
So we're still pretty early on this study. We have had really, really good success so far, and I think the one patient that was eligible at the time said yes to the study. On the study that I just finished up, the one that I showed you the results from, we had really, really good recruitment. It was almost 100% of the patients who walked through the door at each of the 3 sites that signed up to be part of the study. And to me, that really, it's tremendously powerful, mostly because I think families and children in particular want to tell their story, and it's very meaningful work for them because they can directly influence how we take care of patients, which is really cool. So we've had a really high commitment and buy-in from our patients and our families so far.
Great, thank you. Jesse, I guess I have a curiosity personally to understand a little bit more about this regulatory process. So Dr. Steineck and I have talked a little bit about it, but perhaps for all of us, because we all have different knowledge points, can you talk about what it means to set this up with these 3 sites, or maybe in tandem with the rest of the team? Kind of give us a perspective on what are these regulatory steps, hurdles, whatever that looks like, just for everyone to understand.
So in the pediatric CTO, this is our very first multi-site trial. And so it is brand new to literally all of us. To say that it's been a learning experience, and I'll try a lot of trial and error is putting it very mildly, definitely an understatement. Seattle is, as you might have noticed on Angie's slides, Seattle is a tiny bit ahead of St. Jude as far as going along in the process. So that's pretty beneficial to St. Jude because Seattle kind of ended up having a little bit of the guinea pig early on of our learning experience on how this was supposed to go. Primarily, we've been trying to model it as much as we can after how the Cancer Center does things, but there are some definite differences in that. And I'm very sorry if you see a cat pop up over my shoulder. As soon as I start talking in meetings, they attack me. But it's definitely been a learning experience. It's kind of up to us though to kind of decide how we feel is best to manage all of this. And Kira and Peyton and Meredith have been absolutely instrumental in helping get this all worked out and figured out. And I definitely appreciate that. I'm the one handling the regulatory stuff, but managing the regulatory stuff, but I'm definitely not doing it alone. So it's been interesting, but we're making good progress now, and things are coming along, and it's just kind of up to us to how we want to do it and how we feel is best to go about it.
has it been a learning experience for you as well, Dr. Steineck, as, sort of in this space of, this research or this study in particular in the multi-site sort of space that you're looking to work in over the next 4+ years?
Each study brings with it its own challenges and learning experiences. And I wish we as an academic community did a better job of writing that down and sharing it so that we can all learn from each other. But I would say Jesse is also being very modest, and it has been, from my standpoint, a very seamless process. And so I have had the privilege of being part of many multi-site studies before, but one of my own design and leadership, and that has been pretty smooth here in comparison. Not that my prior study was hard or whatnot, but I think there are a lot of processes and a lot of red tape to get through on multiple different levels. And I think what Jesse's done a really good job of is recording a lot of those things and being consistent with follow-up and making sure that we're doing the same thing with the different teams and learning from what barriers we've encountered so far.
Well, thanks for providing that perspective. I think that slide that Dr. Steineck showed of those 3 sites, it just gives us a better viewpoint of the scope of this work and the number of people that are involved with it. I'm going to take a quick break because I just see that Dave Benson has joined this call. And Dave, we have just heard from Dr. Steineck, who is the researcher that the ACRC is supporting this year. And Kimberly said you might want to just say a quick hello to this group. I don't mean to put you on the spot, but if you want to do that, I know your time is valuable. So I just thought I'd give us a quick pause for a minute and turn it to you if you have any comments or insights for this group.
No, first off, my apologies. It's that time of year where we're getting pulled in a lot of different directions as we're trying to raise as much money as we can to support incredible research like Dr. Steineck's research. And so I just mostly wanted to extend a heartfelt thank you to our Research Council members here in the North region, because your work is literally saving lives. And I'm bummed because I wanted to hear Dr. Steineck talk about this incredible work that she's doing, which, everything I've heard is just so amazing. And it's exciting for us to be able to support the brilliance that Dr. Steineck has, but researchers like her all over the country are benefiting from the dollars we raise at the American Cancer Society. And it's why we can stand here today and say we continue to put cancer mortality rates on the decline, and see so much progress in the fight against cancer. So just a huge shout out to everyone involved with this Research Council. A big thank you. Know how much we appreciate your support and helping us support researchers like Dr. Steineck.
Well, thank you, Dave. We appreciate you being here, and we all echo sort of the thought of the thanks and the opportunity to hear from Dr. Steineck in this work that is developing and emerging through her support from the American Cancer Society. Changing gears just a little bit, I want to make sure that we open the floor for questions from all of the members of the ACRC that are here. And if there are any slides that people have questions about, Jade has those at the ready. But I just wanted to sort of, pause and say, are there any questions from the group thus far about what we've heard from Dr. Steineck and then the members of our team that are with us today?
No questions, just a big thank you very much. The regulatory stuff sounds very complex. So I'm guessing perseverance is a good competency that you all have in stride.
Dr. Steineck, this is Joyce. you used the word intervention earlier in your slides, and you may have covered this in our first discussion, so I apologize if you did, but trying to understand what in the process intervention encompasses, or can you briefly describe to us what that is?
Yes, thank you, Joyce, so much for calling me out on that.
Well,
I
didn't mean
think
to call you out, trying to understand.
no, that's okay. Intervention is one of the words that I use interchangeably with education program or supportive care program, all part of this thing that I'm trying to make that will help families cope with uncertainty as they go through CAR T-cell therapy. So in the science, we use the word intervention because it is, everything comes from clinical trial science where you do something and you measure the effect of that thing. And so that thing is the intervention.
Okay, thank you. That's what I presume, but I just wanted to kind of understand that better. And so it's not really changing the course of their treatment. It's their medical treatment per se. It's
right.
This, understanding
Yeah.
there's the burdens,
Yeah.
etc. Okay, great.
Not changing their medical care per se, but maybe giving them some additional psychosocial support through their experience, whether that is through better education of what to expect, empowering them to talk with their team about certain concerns that they have that they might not otherwise feel like warrant discussion. So for instance, patients with cancer expect to experience certain symptoms, right? Nausea and fatigue are part of chemotherapy, but does it have to be, and should we still be talking about it in our encounters with our clinicians? And I would argue yes. And so one of my hopes is that we can use this program as a tool to help facilitate those discussions between the families and the clinicians.
Okay, great, thank you.
Yeah.
Any
I'm
other?
curious.
Yeah.
Yeah, I have one. I thought it was really interesting seeing at different points in the treatment what side effects were burdensome, and I guess it makes sense as you go along they might change, but I was curious if anything surprised you or what you learned from that, because it seems like such a great pathway to be able to know what to assist with at what point, like seeing anorexia being like so low, and then pop way up to the top. That one surprised me. So I'm just curious what you've learned from that and anything that surprised you.
Yeah, I think some of the things were that it tells me a little bit of what I would expect with the treatment. So, in the shifting of how things evolve over time. But I think it comes down to two things. One, that things become more burdensome when they're not expected, right? If you are at 3 months and you still don't have your appetite back, then you start worrying about that, right? And that becomes more of a problem. I think the other thing that surprised me was that early on, it was a lot of the physical things that I would expect, the nausea, the fatigue, the pain. But as patients went further out from their therapy, things like anxiety and worry and concentration and some of those other more cognitive or psychological components became more burdensome as they went out over time. And part of that, I think, comes back to my central hypothesis, which is that people start worrying about the future and the uncertainty of the future. And so helping families cope, even identify that, name that, and then give them some of the tools to cope with that, I think will make the whole experience a little bit more bearable. The other thing that I thought was really fascinating was that overall, the scores for the symptoms were actually lower than I expected. And I think part of it was that the kids and the parents expected a certain amount of symptoms with the treatment and just accepted that as a fact. So that was really interesting to me, and I don't know what to make of that. Other than kids are really, really tough and are able to get through a lot.
Dr. Steineck, when I'm just, the slide that you had, and I have access to it because I saw this before today, but, you were talking to children, the patients and the parents, and interviewing them separately. Is that what you were saying? Did you ever, did you find conflict amongst those, like if you did a child and then parents, did you find similar messaging, or did you find things were at odds with each other in terms of what you heard? Is that a fair question based on the fact that you were talking about children and parents and what you were sharing with us?
Yeah, that's a really good question. So for the current project, we haven't gotten to the parent interviews yet. So I don't know what the conflicts are there. With the prior study, I surveyed them separately. And so part of my, I got to first things first, and I had to finish looking at the project from the first standpoint and getting this paper out. But next I would like, and part of this is looking at whether or not they match the parent reports and the child reports. So TBD, maybe next time I talk to you guys, I will have that data. But I also interviewed patients and parents as part of that study, and we did the interviews together. So it was a little bit different than what my current study is going to do. And yes, there was some disagreement, and it was fun to listen to the back and forth between the patient and the parent, because it was usually a teenager, and there's some head-to-head conflict of, well, that didn't really happen. But I thought it was really helpful for a couple of different things. One of the side effects of CAR T-cell therapy is neurologic toxicity. And so some of these patients were really, really sick when they got their treatment, or even in the ICU with really bad fevers or headaches or things like that. They were really tired and sleeping for a lot of the time. And so they don't remember a whole lot of the things that happened during that time. But their parents do, right? Because watching your child go through this, it's all very, very real, and you remember all of that. So that was really interesting to hear some of that dynamic discussion back and forth. But for the most part, the patients and the parents agreed. So we'll see what the surveys say.
And I think we all will be interested, because you said in the next 6 to 12 months, you're expecting these interviews to kind of roll forward. And I know that we typically, as the Advancing Cancer Research Council, look at a 12-month period, but I think we might try to connect to you more specifically, because I think there's some curiosity in what you will find. And I think having what you've done previously in contrast to what you're setting up to do is going to be really interesting for us to come back to. So even though we usually say it's sort of a 12-month period, you may hear from us well into 2025, because it would be really interesting to hear, if you're looking at in the next 12 months, 45 plus interviews, you may not have a complete resolution on what's happening, but I think your brain will probably be kind of spouting all sorts of ideas. And if we can bring you back for a visit, I think we'd love to have that perspective after having all of this information about how this is being set up.
Absolutely. I would love that.
That would be great. Any other questions from the group? Well, this is a fairly quiet group today, but I think that's just fine. Any other questions from the team, that the ACS team, that anything that's curiosity.
Kathleen, I'm at awe. This is my first time, and I don't know that I had the opportunity to introduce myself. I'm Kimberly Bostic. I'm the new Region Philanthropy Director, and I'm just learning about all of the amazing work that you're doing, Dr. Steineck, and I am so in awe and just can't wait to learn more. And this group here that helps to support the funds and the work that go towards your work, it's an amazing opportunity. So I'm just happy to be listening and learning.
Well,
We're
thank you,
excited to have
Kimberly.
you. Yeah, we're excited to have Kimberly overseeing our team and moving us forward. Well, thank you. Dr. Steineck, as I said, we're going to keep you nearby because I think there's some curiosity on the, you're in the midst of what, 5 years, you said? This is still the beginning. And I think having the thought that you are thinking 10 years out and the study, or this funding from ACS is a 5-year sort of space is going to be wonderful for us to understand a little bit more about where things are going and ultimately what that intervention education sort of space looks like for these families and for the patients, the individuals. So thank you for providing that perspective. I will just say, while this is the end of the year, this group really does move into 2025. We will continue to meet. The group, hopefully, we're looking at February for next year as another means of getting together. That may be some check-in from Dr. Steineck, but also we love having other guests join us to talk a little bit more about the research piece and what's happening at the American Cancer Society. So that may be a slightly varied hour together, but we always want to see what's happening with what we're supporting and then look more universally. There is a lot going on at ACS that we can talk about, and I think we want to bring that to this group. So look forward to something in the new year, probably in January, to look at some meeting of this group in 2025. And then, of course, as we have in the past, now we're moving into April of next year to look at a new year of the ACRC. And we are so grateful for everyone's support and interest in this work, because I think it's fantastic to have this opportunity to be around this team that's building on work that will help guide treatment and science for tomorrow. That's really just an amazing opportunity for all of us. And also to wish everyone a happy new year as we are ending 2024 and moving into a new year. And obviously some thanks overall for everything you do from the American Cancer Society. We're very grateful and look forward to sharing more with everyone in the new year. I will say, for the folks that didn't join this call, we do send this out and we will send it out to the group as well. So if there are questions based on some of the slides that Dr. Steineck provided, feel free to reach out. We're always wanting to make sure that those questions and curiosities are answered. And I think Dr. Steineck and team are a great partner in making sure we have that knowledge shared across this group. And otherwise, I think that covers it. Am I missing anything? I'm looking at the team here. Jade, did I hit everything?
You hit everything.
Okay, good. That's wonderful.
Thank you so much. Thank you so much for sharing.
Yeah, it's wonderful. We're really thrilled to have the perspective. Before we go, any last minute questions? I don't want to miss anything. If someone has any extra thoughts or questions from the group.
Thank you very much. And happy holiday to everybody. Happy holiday.
Yeah, happy holidays. Enjoy.
Yes, enjoy the holidays. Thanks, everyone. Enjoy
Happy
the rest
holidays.
of the year. Take care.
Bye.
Thank you.
Bye.
Bye.
Thank you. Bye.